Hello everyone, my name is Krish Punyarthi and I am presenting about addressing thrombosis on the global scale, from awareness to action. I am a rising senior at Alliance Academy for Innovation in Cumming, Georgia. My ways of professional development include the Global Thrombosis Forum, GTF for short, in which students get the opportunity to work with physicians to spread awareness of thrombosis through research projects and presentations. I personally have participated in multiple research presentations, such as the role of family history in the management of VTE at the Thrombosis and Hemostasis Summit of North America in the picture above, and thrombogenesis in sickle cell anemia at Loyola University in the picture below. Those are my two favorite ones. I also co-founded Cancer Zero Alliance, in which we are dedicated to promoting awareness of different types of cancers and their risk factors through planned seminars and info sessions. Through these two nonprofits, I was able to earn the Golden Presidential Volunteer Service Award for over 250 hours of volunteering, which you can see right here. Some of the activities I do for fun include Taekwondo, in which I am a black belt, and table tennis, in which I compete at the state level in. My future interests are in the realm of cardiology and global health. So before we get into this topic, I would like to run you through a brief overview of what we're going to talk about. First, we will understand thrombosis. Second, we will talk about the global health implications. Third, my research. And finally, conclusions. So what is thrombosis? Thrombosis is when a blood clot forms within a blood vessel, and this can cause the obstruction of blood flow in the circulatory system. Now, what is a blood clot? Blood clots form to help stop bleeding from damaged blood vessels to heal our body whenever we get hurt. However, this can also cause problems sometimes. You can see the clot in the picture to the side. There are two types of thrombosis: venous thrombosis, which occurs in the veins, and in venous thrombosis, there are two types of thrombosis that make it up: deep vein thrombosis, which occurs in the leg or lower extremities, and pulmonary embolisms, which are thrombosis that travel up to the heart or lungs. Then there's arterial thrombosis, which occurs in the arteries and can lead to conditions such as heart attacks and strokes. Some early preventative measures include exercise, diet, and just moving around every hour or so. And some main treatments include direct oral anticoagulants and heparin. The importance of addressing thrombosis on the global scale. The purpose of creating this presentation was to raise awareness of this prevalent yet unknown condition. For example, through my work at GTF, I go to booths and spread awareness in our community, and I found that almost 90% of people didn't know what thrombosis was. And that was what motivated me to continue to do my research and spread the word. In the statistics below, you can see that 1 in 4 people die from conditions caused by blood clots, and approximately 10 million cases of VTE are diagnosed worldwide. In the picture to the left, you can see heart disease being the leading cause of death worldwide, but what is not shown is that thrombosis is the leading cause of death in people with heart disease. Second, you can see cancer, but what you can't see is cancer-associated thrombosis, or CAT, which is very common as well. Okay, now going back to point 2, I want to educate and mobilize you all listening to let you further spread the word of this condition and make this a preventable condition, because this actually is very preventable, doing things I mentioned on the previous slide. In the third statistic, you can see that clots are the leading cause of preventable hospital deaths. With further education and knowledge, we can drastically reduce preventable hospital deaths. Now I'm going to go over my brief research and the findings I found. Let me provide you with a little bit of background before we begin. The Caprini Risk Score is a risk assessment model that includes many risk factors for patients with VTE, and it provides a score. The objective of the study was to increase awareness of VTE and its related risk in the community and assess individual baseline thrombosis risk scores before illness. The study design was non-experimental, using a cross-sectional survey, and at GTF, students collected data from 928 participants from the USA, UK, and India, and were given a risk assessment ranging from low to very high. This number has actually risen to 2,000 as the study is continuing to be done. The participants' identities were blinded and was approved by DePaul University's Institutional Review Board. Now let me explain a couple findings. First, we found out that those with a family history of blood clots had a already increased risk of thrombosis, as demonstrated by the graph above, with most of the data points hovering near 4 to 5. Second, another key finding we found was that risk increased as age increased, as you can see by the linear trend observed in our graph. From our study, we were able to conclude that family history, age, smoking, diabetes, and contraceptives significantly increase VTE risk, and enhancing public awareness is essential to reducing fatal PE events. The importance of the study was to identify risk factors early to help lower VTE incidence rates and highlight the need to bring this Caprini risk score assessment to your primary care physician in order to further lower mortality rates. In conclusion, thrombosis remains a formidable global health issue that is very widespread but unknown, causing mortality and morbidity. The sheer prevalence highlights the need for increased awareness and better prevention strategies and innovative treatments. Now, I task you, the audience, to spread knowledge about this disease, promote lifestyle changes, and donate and support novel research. And when you leave, I want you to think about how you can contribute to reducing the global burden of thrombosis in your community. I would like to thank the Global Health Leadership Conference for providing me with the opportunity to present my research, the Global Thrombosis Forum for assisting me in conducting my research, and my parents for supporting me through my whole journey. And finally, you, the audience, for listening. These were my references. Thank you so much for listening, and here's my contact information. Feel free to contact me with any questions you may have.